Hello my dears, how are you? Hope you're well. Thanks for joining us. Today is my first vlog post-surgery. So, as any of you who watch this channel will realise, the last time that I spoke to you was indeed when I was about to be going for my gender confirmation surgery the following 2 days later. It happened. The surgery was a complete success. I have had a few issues which I'll go into in a little bit. Thank you for everyone for your best wishes throughout all my social media streams. I feel really blessed to know so many wonderful people. Thank you all. In the first few days after the surgery especially, I think it was kind of knowing that I wasn't alone that got me through. So thank you all from the bottom of my heart. It means so much. Where to start? Okay, so I went to the hospital, got to hospital. Well, I actually got to Wimbledon. I had the surgery at Parkside Hospital, which is in Wimbledon. It's about a mile and a half from Wimbledon tube station. I decided to walk once I got the train to Wimbledon on the basis that I wasn't going to be able to walk for that distance for some time. It started to rain when I was half a mile into the journey, so I got there pretty wet. Ridiculous. And settled in and stuff that evening, had my pre-op checks, everything was fine. Night before, kind of tried to make my peace with a lot of things in my life, lying here. I spoke to God, as I did quite often, as I have often. I'll go into that in a little while. But yeah, it was really weird. Didn't really know what to expect. I knew it was going to be painful, but how painful I had no idea. So I kind of, I did what a lot of us do when we cope. We know that something's coming up as big and we know it's going to hurt a lot, so I tried not to think about it. I mean, ultimately it's not going to change what happened. So I just, went there and thought I'll deal with it when I come to it. The morning of surgery, I was woken up quite early. It was just about 6 in the morning. I had to have an enema. Wouldn't recommend it. Not the most pleasant experience I've ever had. Not the worst, but certainly not one of the most pleasant. What was rather funny is the nurse offered to allow me to do it. Or she said, do you want me to do it? And I said, well, as she'd done it, and I'd never done one on myself before, it would be better if she did it. And she said she loved giving enemas, which for someone who's about to go into surgery and for a nurse to come to you and say they're enthusiastic about giving you an enema, I was a bit shocked, but it must have been her sense of humour. But yeah, it was quite funny. She put it in and within seconds it worked. I mean, she said if you can try and keeping it in for like 5-10 minutes. Nah, didn't happen. I expelled as I had to prior to the surgery and pretty much straight away. So that was good. And then I read a book, The 4 Agreements, and I was reading the first part of that book. If you read a book in your life, read this book. Amazing. I can't remember for the life of me who the author is, but it's an amazing book. You should really, really read it. The 4 Agreements. So I was reading that the night before, and I started reading some of it in the morning, and the nurse came in to me, and one of the nurses, and she goes, look, it's not your turn first, so why don't you try and get some sleep now, and then I'll come and wake you when it's your turn. I wasn't worried, but obviously I'd been thinking about the surgery the night before, so I didn't really sleep that well. I did get some sleep, but you're in a hospital. I was in my own private room, thankfully, but it's still a strange bed, single bed. My other, my fiance wasn't there and stuff, so I did kind of struggle to sleep. So I went to sleep maybe about half 7. She came and woke me up at 10, and she goes, right, it's your time. And I was like, what? It felt like I just closed my eyes a few seconds ago. I'm glad I had that sleep. And so I'm putting my gown on and stuff, and she goes, I can't believe how happy you look. She goes, I've never seen anyone look so happy. It was the fulfillment of a lifetime's ambition to be rid of what I was assigned at birth but didn't ever feel comfortable with ultimately. Kind of mixed emotions. If I look back, if it's a bit of a blur, if I'm honest with you, but I remember walking down to the lift, and then we went down to the operating theatre, which was quite cold, hence I had a dressing gown on. Got down to the anaesthesia. They did loads of thorough checks with my name, date of birth, made sure I signed the consent form, made sure it was my signature. I knew the process was irreversible, etc., etc. And then I was talking to one of the anaesthesiologists about my job. chatting away and stuff, and then she went to put in the first, don't know what it was, bit of anaesthetic or whatever, and she goes, this is going to feel like a few gin and tonics. I did ask for a few gin and tonics instead, but she said no. But, you know, they put it in and it felt woozy. It was really, really odd how, like, fine 1 second and the next second I was a bit woozy. And then one of the other anaesthetiologists put the mask over my face, and it goes, right, we're going to count to 20, and by the time I get to 20, you know, you will fall asleep and then you'll wake up in recovery. And me, I was just like, no, it's not going to happen, I'm going to be 20. And he went, 1, 2, out. I was completely out. The next thing I woke up in recovery. I went into the operation just before 10 o'clock in the morning, and the lady who was in after me, she told me that at 10 to 12 I was being wheeled out. That's incredible. Less than 2 hours basically. They redid it, everything. Incredible. I had a full neo-vagina. For those of you who don't know, there are varying degrees of surgical interventions you can have down there. You can have a cosmetic procedure, so to all intents and purposes it looks like a vagina, but there's no depth to it, if you like. I chose to have the neo-vagina because I want to be as authentically female as much as I possibly can physically, currently, with, you know, surgical techniques as they are. So yeah, and I woke up, I came round, and I was just like, it was kind of waking up drunk, if I'm honest with you. They made me wear an oxygen mask for about 10 minutes, and I was able to put my phone on, my glasses and stuff, and text home. And it was weird. It's kind of, the only way I can describe it, the feeling afterwards, apart from the kind of effects of the anesthesia and stuff, is like one of relief, like, oh my god, it's finally happened, like kind of overwhelmed, had a bit of a tear and stuff. But the physical sensation, it's like, I'm not trying to gross anyone out. If you don't want to know the next minute or so, then just fast forward. But essentially it was like when you're dying for a poo and you're really, really full. That's what it felt like, but between my legs. So yeah, I had the tight packaging on as well that they put around you, and went back to my room. They wanted me to try and have something to eat after about an hour in my room, so I had already pre-ordered my lunch, and they kind of gave it to me mid-afternoon. I'll be honest with you, because the anaesthesia, I just threw it back up. It wasn't pleasant. It went all over the bed, and the nurse had to change it all and everything. But yeah, that was kind of the first like couple of hours after surgery, and then luckily I was able to keep my food down the next meal. First day I had a morphine pump. I didn't really use it that much, to be honest with you, but what the anaesthetist did say is they were going to use a injection they put in the spine, epidural. Apparently only 1 in 10 people don't have this hole in the bottom of the spine, so after your vertebra, so after lumbar 5, then you have your sacral and coccyx. In between the sacral and coccyx there's normally a hole a lot of people have, and basically they put an epidural in there. Now, as well as being pain relieving, this also aids with swelling as well. So he did say I'd had that, and then yeah, it was just a question of wait until the next morning and see how things progressed. Normally what they do is they remove a pressure dressing after the first 24 hours. They leave that in to kind of make a good seal with them, what they've done and stuff. They came to remove mine, and basically I bled quite badly in the night, and they thought, right, we're going to leave it on for a little while and see how things progress. They drew a line on the pressure dressing that they put on me, and there was loads of plasma just coming through it. And then it got to a stage where, again, if you don't want to know this, then fast forward for a little while. But I had bleeding from the urethra, and it was just blood, blood, blood. So they had to remove the pressure dressing, put another one on for another 24 hours. It was okay. I mean, he said, look, you're going to have to stay still for another 24 hours, which I had to do. They took the morphine pump away, having put this pressure dressing on as well, which is a bit, you know, because I knew then I was going to have to be on paracetamol and ibuprofen only. My consultant, other consultants may vary, my specific consultant told me I don't want anyone else to give you anything else, but you know, you're only on ibuprofen and paracetamol, that's it. Because opiates have a danger of causing constipation, which can then have implications with the neovagina, cause it to collapse. And there was no way that I was going to risk that, having gone through that much to go through the surgery. So yeah, had 5-6 days with a catheter and stuff. Had loads of lovely people came to see me. Thank you to those who did, because it really made a big difference, as well as the ones, you know, showing the love on social media. And then day 6 after surgery was when they came to remove the pack and stuff. Actually, I had surgery on a Saturday and this was on a Thursday. So they removed the packing. I mean, that was a relief more than anything else, because little bits of it had started to come out, and they did have to tuck it back in a few times, which was a bizarre feeling. But yeah, then they removed the packing. The smell was like something else, honestly. I've never smelled anything like it. The removing of the catheter, my goodness. If anyone's ever had a catheter inserted, then they'll know what I'm talking about, but that was very, 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 very painful. And then it was, I had to do my first dilation. To anyone who doesn't know what that means, essentially we have to, post-operative trans women, we have to dilate, or our neovagina will actually close up. It can be, once you get into your transition in like 3 months, etc., post-surgery, then you can try penetrative sex. Penetrative sex can take the place of dilation, but I will have to dilate for the rest of my life. I'm going to show you the dilators now. So again, if you don't want to see this, fast forward for about a minute or so. This is the first dilator, my post-surgical friend. I call this one birther because it's the one that goes in first, birthing. That's the diameter of the thing. That's the size of my thumb, so it kind of gives you an idea of how thingy it is. But I had to insert the majority of that one first, and then I have girther. This is I call her girther. You'll see why in a minute. That's the second one. That has to stay in for 20 minutes. Again, it's just to kind of help the neovagina stay open. And for the first 8 weeks post-op, I had to do that 3 times a day for 20 minutes a day. That's the way my consultant advises his patients to do it. Again, each consultant is different. With mine, that has worked. I went down to 2 dilations a day after my 8-week checkup, and I'm now down to 1 a day. It's trial and error. There's no right and wrong. Some people can go down to 2 and 1 a lot sooner. Some people have to keep it up for a lot longer. Each individual is different physically. The first few weeks after surgery, once I got home, hell, absolute hell. A lot of pain. Nerves reconnecting. I don't know if any of you had surgery watching this, but essentially when the nerves reconnect, it's kind of like an electric shock and someone with a pair of pliers pulling and twisting at the same time. That's the kind of the best analogy I can use, but honestly, very, very difficult. I had some dark times. I really struggled to cope. I had all these grand ideas, but I'm going to read 7 books after my surgery, and I'm going to finish writing my book, and I'm going to be doing loads of writing and everything else. Did none of it. I didn't kind of fully appreciate the kind of physical and emotional trauma I would go through after this surgery. I don't regret it, not for 1 second, but having said that, I wouldn't want to do it again. Definitely not. I mean, I can't anyway, but yeah, the pain was unbelievable. Paracetamol and ibuprofen barely touched it. My partner, luckily, she looked after me for the first week after I came home. She was here to help me off the bed, to look after me, to do my meals, everything. I couldn't, she was a nurse to all intents and purposes. I couldn't have done it without her. But the emotional struggle as well. I mean, I'm a very active person, do a lot, and to have to go from doing everything to doing nothing took a lot of psychological adjustment. I was really, really down for a long time. I'll admit in the early days as well, I did regret doing it. I'm like, why did I do this? Why didn't I just leave things as they were and stuff? But those days are gone. If I can go rewind a bit and go back to the first time after surgery and after the packing had gone and everything else, when I could stand up and have a shower, which was amazing. Having not showered for 5 to 6 days, but to be able to go and stand in front of a mirror and for things to match or things to look as they should, you can't describe it. I just broke down in tears. Absolutely phenomenal. And every time I look in the mirror now, it's like, oh yeah, I still catch myself smiling. I have put on a stone in a bit since my surgery, probably down to eating, and I have boredom ate a little bit, not loads, but a little bit, but also the level of inactivity that I've had to go through as well, because, I tried doing a 30-day squat challenge a few days ago, I'll admit it, and I got in day 2. After the second day, I just had to stop because it was killing me. I am going to get back to it eventually, but I'm going to build my activity up slowly. But you know, the early days after my surgery, when I was feeling low and stuff, it was really difficult. I cried a lot. I don't mind admitting that. Through pain, sometimes through frustration, sometimes through anger. Now it's just, it's quick. It's weird how quickly your body forgets what it was like and how your mind kind of puts it into a place where you don't have to deal with it anymore. It was a dark period, but thankfully I had someone with me who was able to support me through it. The kind of, if there's any bit of advice I could give to anyone out there, is kind of prepare yourself to be in pain, but also be patient and kind enough with yourself. One of the things that my other half said to me, and I'm going to say this now, you know, till the day I die, to anyone kind of considering this procedure or any kind of physical procedures for that matter in the transition, is like, if you broke your leg and you had a recovery period, you would, without doubt, expect to be in pain, and you'd also give yourself the time and the patience and the kind of the emotional effort to get better. You need to do it with this surgery as well. It is major surgery. I mean, it took less than 2 hours, absolutely, but you know, trying to use a phrase that kind of is accessible for anyone who doesn't want to know the ins and outs of it, but essentially it's major rewiring. Everything is getting changed down there, and you know, physically I am kind of used to it a little bit now, but you know, it's having the time and the patience and the care and the own personal compassion with yourself to kind of give yourself time to recover. It's fine. It's going to hurt. It's going to hurt for a long time. Just be patient with yourself. Now I'm at a stage where I've just had my first day back at work. I wanted to leave it until this time to do another blog because I thought blogging about the whole experience rather than nit bits of it would actually be more effective, if I'm honest with you. And also I haven't wanted to kind of do this until now. I kind of feel now that I can share this. I am going to keep blogging as well about my life and how things are going, because I think ultimately I have a little bit of a following now, and people obviously watch this are interested in the progress that I'm making and stuff. Thank you all, it means so much. Outside of my transition physically, everything's going really, really great. I have been nominated for the National Diversity Awards LGBT Role Model for 2016 here in the UK. I'm hoping I'm going to be shortlisted. I have to do a bit of work towards the nomination after this blog, but the results will be announced on the 20th of July. So, you know, even if I don't get shortlisted, the fact that people have taken the time to nominate me, and some of the nominations were amazing, and you know, I was just crying. Reading through those actually did help me with the recovery period as well. I kind of understand trans people who go through their transition surgically and stuff, and then they want to kind of become stealth or kind of blend into society and stuff. I see it as something that I've done from the start of my transition, so I see no reason why to stop doing it now. I hope anyone watching this who is considering surgery or has kind of come up to their surgery feels a little bit better about the process, or at the very least has a little bit more understanding. It's not for everyone, I get that totally, and it was my decision to do it because I've always wanted to do it. I wouldn't say go for it. It's an individual thing, and you know, only you can make that decision, only you know your circumstances, but it's one of the best decisions I've ever made, because now everything matches. And you know, I'll tell you a little bit. I went knicker shopping for the first time since surgery 2 weeks ago maybe, and being able to look at underwear and not thinking, oh, how am I going to tuck and hide stuff, all the pain, all the angst was worth it just for that. Like, I can now do the things that I've always wanted to be able to do, but kind of couldn't because my physical essence was holding me back. And yeah, amazing, wonderful. I hope you've enjoyed me sharing that little bit. Sorry if it's been a bit too graphic, but you know, I did give warning and an opportunity to go a bit ahead if you were grossed out by such things. Sex life, I guess you're going to be a bit curious about that. I'm going to do a series of videos talking about sex and some of the things that will come up through my channel anyway. But I've had a bit of a try, but it is still early days. I have got some sensation down there, but even as recently as a few days ago, I'm still getting those pains and nerve reconnections down in the area where the clitoris and stuff is. You know, even this far after surgery, nearly 3 months now. So yeah, I look forward to my clitoris becoming more sensitive and being able to enjoy sex again and not be worried about how it is. But I'm excited to learn how it all works and what works for me and what doesn't and stuff. Yeah, it's amazing. Thank you everyone for watching. If you would like to subscribe to the channel, I'd really appreciate that. Also, then you'll get an update every time a new video is loaded up. I am going to be starting a new project in the next few weeks, and I look forward to sharing that with you. Until then, take care of yourself, and like I always say, be yourself, no one else. Take care. Bye.